I'm good. How are you?
Doing good. I'm Brady. I'm going to be your nurse today.
Okay.
And I've reviewed the orders that the doctor's given me, and he wants me to do vital signs on you and do cardiac and respiratory assessment if you're okay with that.
I'm good with that.
Okay. Well, first I'm going to sanitize my hands.
Okay.
And I'm going to close this curtain here for privacy. All right. And I want to verify your name and date of birth.
Crane Wilkinson, 7/14/1984.
I'm pretty sure.
I think so.
All right. Well, the first thing I'm going to do is check your pulse, and then I'll do your blood pressure. Have you had any caffeine today, or the last 30 minutes?
Not in the last 30 minutes.
Okay. On any kind of blood pressure medication, anything like that?
Nope.
Okay. All right. Well, we're going to start with your pulse. Just turn your arm over and relax for me, and this will take just about a minute. Okay, your pulse was 64 and it was a regular beat, but your respirations were at a 7.
Oh,
so, which is pretty low, but are you really relaxed right now?
Yeah, I'm relaxed right now. I don't have any problems.
I tend to do that to people sometimes.
Yeah.
I'm teasing. Okay, well, I'm going to go ahead and check your blood pressure to see if that's normal. Okay. And there's not any stents in this arm or lymph node removals?
No, ma'am.
All right. Okay, just slide the phone on there for me. I'm gonna make sure this is on the brachial artery so that we can get a good pulse. And your normal blood pressure is what?
115/70.
Okay. Okay, it's 110/70, that's fine, so you're in normal range with that. All right, so that's a normotensive blood pressure. If it was high, it would be a hypertensive blood pressure. And while I was doing her pulse, I was inspecting her respirations, and we're going to do a respiratory assessment now, but I was looking at her respirations, and she was breathing deeply, and her respirations were low. So I could see that she was taking deeper breaths, and that might have been why. I'm not sure exactly at this point, but I'm not really concerned about it because her other vitals were normal. And have you been in any pain or anything?
I've had some shoulder pain.
Okay, in your, which shoulder?
Right shoulder.
Okay, and you have that, what kind of pain is it? A sharp pain?
It's just like a muscle ache.
Just when you exercise?
Yeah.
Okay, and does it stay in your right shoulder or does it radiate?
I'd say it's in the right shoulder.
Okay, and it's just no intermittent pain, just only when you exercise?
Right.
Okay, and have you been taking anything for it?
Some 800 milligram Motrin.
And that helps?
Yes, absolutely.
Okay. All right, well, so I'm going to continue with her respiratory assessment. And like I said, I've inspected her chest to see how her breathing is. Is it shallow? Is it deep? And she's breathing normally. So we're going to go on and listen to the eupnea is what she has right now because she's breathing normal. And so we're going to go ahead and listen to the sounds in her lungs. Are you okay with that?
Yes.
Okay. And you're going to start with her right upper lung. and listen. And she sounds like she's breathing normally. I'm not hearing any wheezing or crackles at this point. But so I'm gonna, this is her left upper lung. I'm gonna go down to her left lower lung. And then her right middle. Okay. And then her right lateral, which is going to be her right lower. And then I'll do her left lower. Okay, and if you'll scoot up for me. And when I go to post posterior for her, I'm going to listen to her lungs again, but this time I'm going to have her take a deep breath in her mouth and out so I can listen a little bit better. I didn't hear anything abnormal in the front, but I'm going to listen a little more closely in the back. And I'm going to start with her right upper lung. Breathe in. Okay, and I'm going to keep the diaphragm up against her and move it over into her left upper. Then I'm going to go down to her left lower. And then her right lower. Okay, and then I'm going to do her right lower on the lateral side. And I'm just doing this one again and having her breathe deeply just so I can shake a lateral. Okay, and so everything sounds good with the breathing. There's no wheezing, no striders, no crackles, anything abnormal that I can see. Have you had any shortness of breath or anything lately?
No.
Okay. And you can tell that she is just fine with that. So have you had a cough or anything? All right, well, and with the patients particularly in the hospital, if they are post-op or in the hospital and they're going to be laying there after any anesthesia or anything like that, you want to educate the patient on being in ambulation so that they can get up and move around so they don't have anything settling in their lungs, and that way they can cough things up if they need to and move everything around to loosen it up a little bit. So I would just educate them with that, and I would tell them how to do that would be, number one, you can take a deep breath in and turn to the side and cough pretty hard, like you're just really trying to get something up, not just like a little bitty cough, because you want to try to get all of that mucus up and get it out, because you don't want to settle in there and cause pneumonia or anything like that. And I would educate them to do that 10 times an hour, maybe through commercial breaks or something. Obviously, only when they're awake. You don't have to wake up during the night to do this. But we also have incentive spirometer, which I would give and tell them you have to inhale and through your mouth like you're just sucking on a really thick milkshake maybe. You inhale, hold it for about 5 seconds, and then let all your breath out. And we'll have a goal set for them on the spirometer of where you want to get up to a certain point. This is going to help the expansion of their lungs. So those are just a couple of things that you can do to educate them. If they did have a bad cough, I would have them cough really hard and take a sample of the sputum and just document what color it is. Is it green? Is it yellow? Is it white? Is it clear? Obviously, if there's a discoloration to it, there may be some kind of infection there. It may already have pneumonia, bronchitis, that kind of thing. And obviously, we would send it off to the lab and have the doctor tell us what he would like to do at that point. So now we're going to go on into the cardiac assessment, and you're going to inspect the jugular vein for distension. So you would have the patient, you would lean them back 30 to 45 degrees, have them look to their right, and you're going to look for any distension here in the jugular vein. I don't see any with her. Make sure you stand on the side that you're inspecting when you do this so that you can see it more clearly. And then have them look to the left. You're going to look for jugular distension here, and she doesn't have any, so she's good there. And then we're going to do palpations. So I'm going to check on bilaterally with all the palpations just to make sure that the heart is beating the same on each side and there's blood flow on each side the way that it should be. So I'm going to check the radial pulse, and hers here is like a +2, which means it's very definitive. a +2 on this side also. Then I'm gonna come down to her feet and do the posterior tibial, which is gonna be behind her ankle. And that's about a +1 on her left. And then you're gonna go to the right, do the same thing. And that one's about the same thing, a +1. And then you're gonna go do the pedipulse on top of the foot. And you're just gonna go straight between the big toe and the toe next to it. And that's a +1. Do the other side, same thing. And that's a +1. The other points that you can check the pulse, we're gonna, is the popliteal right behind the knee. And once again, you're gonna do this, like I said, on both sides. And you can feel it right there behind the knee. The femoral is gonna be in the groin area, right up at the top of her leg. More so, I can show you here. I don't wanna make her stand up or anything. Then the axillary is gonna be up under the arm, which I've heard that you really can't find that very well, but the brachial is the pulse that you're listening to when you're doing the blood pressure. And also the carotid, which is gonna be in the neck. And do not do that at the same time or they will pass out. So next I'm going to check for a capillary refill. And what that is you're gonna take each finger and you're gonna just press down on the fingernail to see if it turns pink within 3 seconds. If not, that means there's not enough blood flow or oxygen going to the extremities. And we wanna make sure that that's not happening. So you're gonna do each one of the fingers. And hers looks good. Okay, and then we're gonna check for edema, which you're gonna do this starting distally, the most distal from the body on the limb that you're working with. So on the feet, you're gonna start down here at the toes. You're gonna hold it down for 5 seconds. Just push down for about 5 seconds, let go. And if there's any indentation and it's not coming back up like a normal rate and it stays indented, then you've got some edema going on. And you're gonna do that on both extremities. And do the same thing. And if you see there's no edema, then you don't have to continue going up the leg. But if you see any edema, you're gonna continue to go up the leg to the hip area. You're gonna do the same thing on the arms, starting at the fingers, the most distal from the body. And you're just gonna hold it down for 5 seconds and let it go. And she looks good. And do the same thing on this side, going all the way up. Now I'm going to auscultate for sounds. Just listening to her heart is what auscultating means. Just gonna listen to the sounds. We're gonna start at her aortic, which is mid-clavicular and into the second intercostal space on her right hand side. And you're gonna go over to the pulmonic. Go down to the herbs, the tricuspid, and then you can have the patient, if it's a female, lift her breast up and go over to the mitral valve, which is going to be your apical point, the PMI, and you're going to be able to hear, hopefully, the loudest sounds here because the apex of the heart is there and it's closer to the chest wall. If you can't hear it, you can have them turn over on their left side, which is going to make the heart closer to the chest wall, and hopefully you can hear it. Have you had any chest pain?
No.
Anything like nothing abnormal or any concerns? No. Okay. And so once you've done all this, you're going to make sure you document everything completely, and that's it. Thank you very much.